JPS Health Network is the public healthcare system for Tarrant County and surrounding areas in Texas. Its main facility, JPS Hospital, is in Fort Worth.
We happen to be the only Level 1 trauma center in Tarrant County, and we're the only Level 1 trauma center all the way to the west as far as Lubbock, Texas.
Level 1 trauma centers like JPS provide all aspects of treatment for severe trauma injuries. Specialized teams and equipment are on site around the clock for immediate response to life-threatening emergencies.
It's really one-stop shopping when it comes to your healthcare needs. You're not stabilized and sent anywhere else. The thing that's really important to us is that we take care of every aspect of that individual's health.
Communication technology plays a key role in patient care and safety.
We don't have physicians that know everything, and we wouldn't expect them to. But in a trauma setting, they need to know as much as they possibly can. And if our systems go down in the middle of the night, that means a radiologist is not able to read a report. That means a surgeon, when they're about ready to do a very strong procedure on someone, may not have the lab results, may not have the allergy results, may not understand what the drug-to-drug interactions are going to be with that particular patient. When we do that, we are putting that end consumer at great risk, and we cannot let our systems go down.
JPS wanted its new IP platform to connect the 42 remote clinics and health centers throughout the county.
Being an integrated healthcare facility where we have multiple locations in the community as well, in school-based health centers as well as community-based health centers, IP telephony has allowed us to move that network and expand that network at a very rapid rate. Some of the business drivers that we took into account when we were looking at doing our major NEC phone system upgrade were visibility into the ACD market and the ACD systems that we have across JPS. We didn't have that visibility, and we were losing calls every which way we could. So that was one business driver. The second one was to reduce cost.
With communication such a critical part of the hospital operations, JPS wanted a new solution that could be deployed with minimal disruption to normal hospital operations.
If we're not allowed to communicate with the outside world with an ambulance service that might be bringing in a car wreck victim or a heart attack alert that has to come in, we have to be ready for that.
The deployment would also have little impact on hospital staff.
Now, some of the challenges that went into that were very interesting because we had just implemented a new electronic health record, which means we had changed processes through the entire hospital to get them cutting over from paper to electronic. The last thing you want to do as a technology executive at that particular point in time is introduce more change to all of those people. So when we were doing that, we wanted to make sure something was seamless, could integrate with all of our internal processes, and that we had the staff and the skill set to be able to manage and maintain that. NEC not only offers a very robust set of features, but at a price point that county hospitals like JPS Health Network can afford to continue doing business. We have a large investment already with NEC at all of our community health centers and our inpatient hospital. Undoing that would have been problematic.
JPS solicited the help of NEC Professional Services to help plan the implementation.
They were able to tell us more about the system and how it would work. They gave us the details, which enabled us to be able to plan for those redundancies that we needed to put in place.
The team planned 4 hours of downtime for the implementation, but the actual cutover was considerably less.
The cutover started at 2 o'clock. We were getting communication updates as to how well it was going, and by 3 o'clock all the tests were done and everything, so it was completed. The next morning, it was basically pick up a phone, and it was like I didn't notice anything different. So that was the big important thing for me, because even though there's a lot of technology out there that is great, if it's not very simple, then you end up not being able to utilize it. So just being able to pick up the phone and nothing really being noticed was a great thing.
IP telephony definitely in a county hospital allows you to reduce cost. Putting together multi-year plans to be able to get rid of some of our legacy telecom systems and putting in IP-based telephony is allowing us to save thousands of dollars a month on those traditional landlines that we had in place. One of the statistics we use right now that was just reported to our board of directors last week was we were able to take our average speed of answer from 9 minutes down to less than 1 minute after we got GNAV in place for all of our community health centers.
The hospital also implemented NEC UC desktop to enable new remote work models.
Recently, we started taking our IT group and moving them off-site so that we could start doing more things with the footprint facility that we have. When we did that, we had to have an IP-based phone system to be able to handle that. We moved our help desk off. They were our first group to move off. We were immediately able to start moving them and seeing all their ACD functionality and all the things that they do normally when they were in their office today, we could now do at their homes. And that was a brilliant design, a brilliant scheme that NEC allowed us to do and helped us put together. And now we can be a lot more effective with people working from home than we were actually when they were sitting at their desk. Before we did our big upgrade, we were probably about 5% IP telephony throughout our environment. Right now we're about 20%, which is a big jump from where we were. We at JPS, I'm very proud to say, have one of the best system uptimes that we can possibly have. But a lot of that is due to our relationship that we have with our partners. We have great relationship with our communication partners at NEC. We have great relationship with many of our technological partners, and they understand the criticality of what we're doing here on a daily basis.